Good afternoon, everybody. My name is Michael. I'm a medical doctor by background and co-founder, CEO of Advoca Health. I'm going to talk to you today about AI because it's really, really important, especially in the context of health. And here's why. AI is probably one of the greatest democratizers in terms of knowledge and capability that we've ever seen. Sounds dramatic, doesn't it? But this is what we're all talking about in sort of the sphere of doctors that I hang out with sometimes. Yeah, and it's not the first time that we've seen this kind of thing happen. So obviously search engines have been around for a long time now, but they play a massive role in people managing their health. So as you can see up there, I believe it says 50 million. Yeah, 50 million health-related searches happened in the UK using Google. And the amount of people using AI is only growing. I think I've read something recently, it's 10% of all searches right now are going through an AI tool. So on that, I wonder if anyone recognizes any of these tools, and a quick show of hands, who has, well, I haven't even asked my question yet. That could have been really embarrassing, depending on what I'm going to say next. Who has used tools like this to answer a health-related question? It's the same number of hands. Everyone knew what I was going to ask. Perfect. Excellent. So what are these tools really good at? So the way that they're trained is they're actually a prediction model, and they're trained on basically a huge amount of text, which isn't very specific. So they're really, really good at language. So they can summarize long articles really nicely for you. They can summarize some annoying long emails that you sometimes get, summarize research articles. Really good use case. They can translate into different languages. They can code and write software. And of course, they're really fun to have a chat with sometimes, I guess. I don't know, maybe I'm the only one who thinks that. What are they not so good at? Can someone please put their hand up and tell me what is wrong with this image that I asked ChatGPT 5.1 to produce? I'm missing a brain and heart. Actually, it is heartless. I didn't even spot that. I'm supposed to be a professional. Yeah, exactly. Yeah, all the labels are wrong. All the labels are wrong. So apparently my stomach is actually in the upper lobe of my left lung. The gallbladder is some kind of strange thing in between the large intestine and the stomach. It's labeled the stomach as the pancreas. Anyway, you get the point. So there's obviously some risk when you turn to health-related. Well, you ask AI health. So the reason for that is because it's trained on such a really broad range of initial training text, and that's especially prevalent in rare disease, where the actual knowledge out there there isn't very much of it. So the training data is actually really, really small on specific diseases. We can fix that with a process called RAG, which I'll explain in a second. But when you have not very much training data, you increase the risk of a hallucination, which is defined as an AI LLM giving an output really confidently, but it's completely wrong. There's also an issue of emissions and also compliance. So if you're asking health-related questions to ChatGPT and it tells you something to tell you to do something to your health, it's got a lot better at not doing that recently, but it's not allowed to do that because that is acting as a medical device. Okay, so a bit more about us and what we're doing, and something actually a specific feature we're building in Advoca. We're building our own chatbot. Sounds exciting. It's pretty cool. I've got my co-founder Sham here, who's behind it all in the audience, and we are solving some of those problems by reducing the amount of knowledge that the LLM can call upon. That's using a system called RAG. So what we do is we can find the best available resources online about rare disease, and we can ask the LLM to refer to that explicitly, and that makes it a lot safer, a lot more trusted. I'll talk more about some of the other features that we have, including to this audio section, but we test Advoca, which we'll talk about in a second, a lot. So over 100 different tests we've done with different scripts going into Advoca to get the results that we want. And we're going through the compliance process at the moment to make this specific feature, which is a chatbot, into a medical device in the new year. Really exciting. So I've got 1 minute left. Here we go. Here's what we do. Advoca is a free app for people with rare and serious conditions. It listens to health appointments for you, and it gives you an easy read summary of everything that has been discussed with you and the healthcare professionals, so you can feel more confident in what's going on. And this is what it looks like. Here's one of the outputs. It's actually using the example of XLH. Very nice. So it gives you a reason for your appointment, gives you a full in-depth summary. You get any results that have been brought up, you get key points, next steps, and also signposting, and soon a chatbot where you can ask more questions. Now, the really cool thing, apart from if that wasn't cool enough, is that we can analyze all of these inputs that go into Advoca, and we can analyze them, and we get something called real-world evidence. Real-world evidence is really, really important to make sure that we can do more research in rare and serious conditions. And that's where working with patient advocacy groups comes in. So we are actively collaborating with patient advocacy groups to offer Advoca with your resources to your beneficiaries, which is great for empowering them, but it also means that we can increase the understanding of that specific rare condition in the population, which would be good for getting to research milestones and getting more funding, all that sort of stuff. If you want to download Advoca, you can get it from this QR code. It's only available for Apple devices at the moment. I'm assured that we're going to have an Android version very soon, but please come and find me after this. It's been great to chat with you all this afternoon. Thank you very much.